everybody, and welcome to the Let's Get Healthy California Innovation Challenge 2.0 Informational Webinar. Today's webinar is being recorded, and all of our participants are joining us in listen-only mode. If you have any questions during the webinar, we have a couple of different ways for you to make your inquiries. First, you can ask questions in the chat window in the WebEx forum. All of the questions entered into the chat window will be documented, and we will include these questions and their answers in our frequently asked questions page on the Innovation Challenge 2.0 website, which is on the Let's Get Healthy California website. Also, if you have questions, you can go to the question forum in the Screen Door online application, or you can contact the Let's Get Healthy California team at lghc@cdph.ca.gov. So first, we'll start with some quick background information. Let's Get Healthy California is California's state health improvement plan to become the healthiest state in the nation by 2022. This plan also serves as an innovative framework that leverages data to improve population health outcomes at both the state and community levels. And Let's Get Healthy California advances the triple aim of achieving better health, better care, and lower costs while promoting health equity by reducing health disparities. Let's Get Healthy California has three publicly facing elements that innovators can reference or find a way to get involved. First is Let's Get Healthy California Task Force Report, which was developed when leaders in health and healthcare from public, private, and nonprofit sectors convened to honor a commitment to work together to make California healthier. The result was a roadmap following 6 goal areas, which we'll discuss later on in the webinar, aligned under 2 strategic directions, which are health across the lifespan and pathways to health. The second element is the Let's Get Healthy California website and dashboard, which can be found at letsgethealthycalifornia.ca.gov. The website is a place where innovators, stakeholders, and the public can explore data to understand population health trends and disparities, as well as discovering innovations and sharing success stories. The dashboard displays progress on all of the indicators used to track the goals for Let's Get Healthy California. Lastly, the Innovation Challenge and Conference is a way that innovators can get involved, and I'm pretty sure it's why most of you are here with us today. The Innovation Challenge and the Innovation Conference create 2 key opportunities. The first opportunity is for connecting communities to each other and linking health systems to population health and prevention stakeholders. The second opportunity is the ability to highlight innovative efforts across the state that are improving health and community outcomes in the 6 Let's Get Healthy California goal areas. So this is the second year that we're hosting the Let's Get Healthy California Innovation Challenge. The Innovation Challenge was designed to promote improvement in population health and health care through new pathways. Let's Get Healthy California team invited communities across the state to submit innovative ideas and projects within the 6 goal areas. Last year was the inaugural Let's Get Healthy California Innovation Challenge, and it really was a huge success. The team received over 100 applications, and 23 finalists were showcased at the statewide innovation conference in January 2016. The Let's Get Healthy California team is thrilled to launch the Innovation Challenge 2.0 with the theme of addressing the conditions that shape our health. Just like last year's challenge, the central purpose of the Innovation Challenge is to engage, empower, and recognize change makers who seek to positively impact the problems they care most about and uncover innovative approaches and solutions that improve health outcomes and address the factors that shape our health. The team is looking to have a very large, diverse, and broad pool of applicants from sectors that advance health and healthcare across the state. We want to see applications about both promising practices as well as evidence-based interventions that address issues and opportunities related to the 6 Let's Get Healthy California goals, or that reduce health disparities and promote health equity, or that address the social determinants of health and are improving community health and health care. Innovation should align with at least one of the 6 Let's Get Healthy California goal areas. As mentioned before, Let's Get Healthy California provides a shared framework to facilitate alignment of efforts and nurture collective impact. The six goal areas are healthy beginnings, living well, end of life, redesigning the health system, creating healthy communities, and lowering the cost of care. Innovation submitted should also ideally align with the Innovation Challenge 2.0 theme of social determinants of health. The social determinants of health are the conditions in which people live, work, learn, and play, which all have a tremendous impact on health status and outcomes. Many factors combine to shape the health of individuals and their communities. These social, physical, economic, and environmental conditions, such as food security, access to services, and community cohesion, are collectively referred to as the social determinants of health. By sharing effective models and inspiring ideas, we can work together to design solutions that shape the health of Californians through the lens of health equity. But don't worry, if your innovation is not directly addressing the social determinants of health, we still encourage all of you to apply, and it will not be affecting your chances of being selected as a finalist. The Let's Get Healthy California team has selected 6 highlighted issue areas as examples of opportunity and efforts underway throughout the state to address social determinants of health. You can learn more about these 6 issue areas on the letsgethealthy.ca.gov website under Open Innovation or in the link in the footer of this slide. Remember, you're not limited to addressing these opportunities. So who's eligible to apply? The Let's Get Healthy California team is looking for a broad range of innovators from multiple sectors that have roles in advancing health and health care throughout the state. This year, there will be 2 tracks that will be evaluated in separate pools. The first track is for innovations from state governmental agencies. The second track is for all other organizations. Please note that all state innovations should go through the normal approval processes before being submitted. For last year's participants and last year's finalists, you should still consider applying again and tell our team how you're addressing this year's theme of social determinants of health and how you have scaled or expanded your innovation. The Let's Get Healthy California team is accepting innovations that fall within the following 3 stages of development: early development or pilot stage, or interventions that are in an active implementation stage, or established interventions that are being scaled or expanded. So applying to the challenge is easy. The online application asks for information about the development and outcomes of your innovation. Review the questions online or download a copy of the application to plan your entry. When you're ready to apply, visit the online application, which can be found on the letsgethealthy.ca.gov website under Open Innovation, or in the link of the footer of this slide. We will now go over criteria that will be used in the review process. The first set of application elements are not scored, but will be used to assist in grouping innovations that are featured on the Let's Get Healthy California website and provide contextual information for those who are reviewing applications. This includes the categories we mentioned before, the stages of development and implementation, initial, active, and scaled/expanded. Let's Get Healthy California goal alignment to the 6 goals, the social determinants of health, and state programs versus other organizations. Innovation Challenge 2.0 applications will be reviewed and evaluated by a diverse stakeholder group. The applications are evaluated on the selected criteria by using a tailored numerical scoring scale from 0 to 5, and scores for each criterion will then be added up to give one overall score for each innovative application submitted. All applications will be scored against a group of standards, so the criteria will be going over, and they will not be ranked or compared against each other. Evaluation criteria were carefully selected by the Let's Get Healthy team to ensure consideration for innovations in multiple levels of development and multiple levels of implementation. The following criteria will be used to score each of the applications: They will ensure consideration of innovations in various stages of development, and all innovations will be evaluated against these 7 criteria. Note that established innovations being scaled or expanded will be evaluated on 2 additional criteria categories, which we will cover in this webinar. The extent to which the innovation proposes a creative solution from business as usual and presents an innovative approach or leverages existing ideas in new ways is the criterion for innovative approach. Population involvement is the extent to which the innovation addresses the needs of the community and or allowed for the target population to help shape the innovation. Equity, the extent to which the innovation contributes to decreased inequities between the best off and the worst off groups. Data is the extent to which data was effectively used to inform, target, and evaluate the innovation. Collaboration, the extent to which the innovation supports and sustains collaborative relationships between entities working together to achieve a common goal. Effectiveness, the extent to which the innovation's results were achieved or show promise of being successful with the intended population. And sustainability, the extent to which the innovation has capacity to result in continued benefit to the target population and ongoing utilization beyond initial implementation. So in addition to those first 7 criteria, established innovations that are being scaled and or expanded will be evaluated in a separate pool from the innovations in an initial or a pilot phase. These innovations will be evaluated on the following 2 additional criteria categories. Adaptation, which is the extent an existing successful idea, program, process, or measure performs when changes are made for a new format, organization, or with a different population. And expansion, the extent to which a tested program, process, approach, or system can be expanded to provide a new program or service. Now on to the timeline. So here are some key dates. The Innovation Challenge 2.0 was launched on September 14th. Today, October 4th, is our informational webinar. The deadline for application submissions is Wednesday, October 19th. And our target date to announce finalists is December 7th, 2016. Please note that this may be subject to change based on volume of applications received, and if there are changes, the Let's Get Healthy California team will be sure to update all applicants. So what happens if your innovation gets selected? As an Innovation Challenge finalist, you have some amazing opportunities. You will have the opportunity to showcase your innovation with organizations across the health ecosystem and share your innovation at the Innovation Conference in 2017 and get your story featured on the Let's Get Healthy California website and connect with subject matter experts. And last but not least, you will get to discover opportunities to scale and spread your innovation. The Let's Get Healthy California team wants to thank you for attending the webinar today. And of course, we also want to thank you for all that you do to help make California the healthiest state in the nation. Again, if you have any other questions about the webinar, please go to the question forum on the online application on the Let's Get Healthy California website under Open Innovation, or contact the Let's Get Healthy California team at lghc@cdph.ca.gov. All questions and answers will be added to the frequently asked questions page. Again, thank you for calling into the webinar. If you have any other additional questions, you can enter them into the chat box, and we will collect all questions and answers, and the Let's Get Healthy California team will post them to the frequently asked questions on the website. Thank you again, and this is the end of the webinar.